Your baby just finished feeding and suddenly spits up. You see it and immediately start to worry. Is this normal? Or could it be a sign of something serious? Vomiting in newborns can be confusing and alarming. I'm Dr. Kunal, and in this video, we're going to break down why it happens, when it's considered normal, when should you be concerned, and what do you do in both the situations. Stick around, this information is going to be very crucial for every parent. And before we proceed in this video, please subscribe to this channel. It just takes 2 seconds. So what are the normal causes of vomiting in newborn babies? Let's start with the good news. Newborn vomiting is usually normal and often there is nothing to worry about. The most common cause is spitting up, also known as reflux. Newborns have tiny immature stomachs and their digestive system is still developing. This makes it easy for the milk to come back, especially if they have been fed too quickly or had too much milk at once. Spitting up is usually just a small amount of milk and doesn't bother the baby much. It typically happens during or shortly after a feed. Other times, babies might vomit a little because they've swallowed some air while feeding, leading to burping and bringing up of a small amount of milk. As long as your baby is happy and feeding well and gaining weight, occasional vomiting or spit ups are completely normal. So when is vomiting considered as a serious concern? Now let's talk about when vomiting could be a warning sign of a more serious issue. Here are the red flags you should watch out for. Number 1 is persistent projectile vomiting. If your baby forcefully vomits and it shoots out in an arc, especially after every feed, it could be a sign of a condition called pyloric stenosis. This condition usually appears around 2 to 6 weeks of age and requires medical attention. Number 2, green or yellow vomit. Vomiting that contains green or yellow bile might indicate a blockage in the intestines. This is a medical emergency and needs immediate evaluation. Number 3, blood in the vomit. If you notice blood or a coffee ground appearance in the vomit, it could be a sign of gastrointestinal issue and requires urgent medical advice. Number 4, associated symptoms. If vomiting is accompanied by other symptoms like fever, lethargy, or a distended stomach or refusal to feed, it is a cause of concern. These could point to an infection or other medical conditions. If you notice any of these symptoms, it's crucial to contact your pediatrician right away or go to the emergency room. So what do you do in these non-serious situations? In most cases, the vomiting is minor and can be managed at home with some simple adjustments. So number 1, feed smaller amounts of milk. Try feeding your baby smaller amounts more frequently. This can help prevent overfilling their small stomachs, which can trigger vomiting. Secondly, burp your baby. Make sure you burp your baby during and after feeds to release any trapped air. This can reduce spit up and discomfort. Number 3, keep your baby upright. Holding the baby upright for 20 to 30 minutes after feeding helps. This prevents the milk from coming back up. Number 4, check your feeding technique. If you are bottle feeding, use a slow flow nipple to prevent your baby from taking in too much milk at one time. These changes can significantly reduce spit ups and vomiting. However, if the vomiting continues despite these adjustments, it's a good time to consult your doctor. And what do you do in these serious situations? If you notice signs of serious vomiting, don't wait at all. Contact your pediatrician immediately or go to the emergency room. Conditions like pyloric stenosis or intestinal blockages often need medical intervention, including surgery. The sooner you get medical evaluation, the better the outcome for your baby. For cases where vomiting is accompanied by signs of dehydration, such as a dry mouth, fewer wet diapers, or extreme sleepiness, your baby might need IV fluids to stay hydrated. Your healthcare provider will guide you in the next steps and the necessary treatment. So let's conclude our video. So why do newborns vomit? Most of the time, it's a normal part of their digestive development, something that can be often managed with small feeding adjustments. However, it's vital to know when the vomiting could signal a more serious issue. Watch for red flags like projectile vomiting, green or yellow bile, or other worrisome symptoms. When in doubt, trust your instincts and consult your pediatrician. Your baby's health and safety always comes first. Remember, every cry and every spit up is just your baby's way of saying, I need you. So stay calm, stay informed, and you've got this. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more tips on newborn care. Have questions or experiences to share? Do drop them in the comment section below. Until next time, Stay informed and keep those little ones safe. Take care.